Continuing on with the skull, we are now looking at it from a superior view. So now we have a really clear view of our two parietal bones. Remember, if you have your hand on top of your head, you are touching both parietal bones. So you can see how they basically make up the superior portion of the skull, as well as wrapping around to the lateral sides. So let's name some of these bones as well as more of the sutures. Remember that sutures are the joints connecting the cranial bones. Okay, we only have to name and label 4 of them. With these sutures, we need to be able to identify what bones the suture is connecting or separating, however you want to look at it. So first, we already know this is the frontal bone. So just looking at it, even if we didn't have it labeled, and maybe we would just go back here, first thing that we should do is label anterior versus posterior. So the posterior portion would be where we can see not a lot of our occipital bone, but more easily to do, we could look anteriorly and see, okay, there's a large portion of a bone here that we can see from this view. So this must be that forehead bone, that frontal bone. So I'm going to identify this as anterior. And by default, that would be posterior. So however you want to look at it, whatever's easier for you to identify, either seeing a large portion of that bone or maybe recognizing a smaller portion here, either way would work. So we have the frontal bone in the anterior position, and then we have our two parietal bones. So we have these are already identified. Now let's take a moment. Can we remember what is the suture that separates the frontal and the two parietal bones? Can we take a moment and remember that? It is the coronal suture. So if you were to put a crown on your head, it would be sitting right there along the coronal suture. Okay? So let's name the suture separating the two parietal bones. This is called the sagittal suture. Okay, sagittal suture. And we remember this word, hopefully, sagittal suture, because sagittal is one of the planes in the body. So if we were to cut the body down the sagittal plane, we would be separating the body into left and right. However, the thing is that it would be unequal portions of left and right. But regardless, we do have a left and a right parietal bone from this sagittal suture. Now, moving posteriorly, we have the occipital bone. The occipital bone is the most posterior and inferior bone of the skull. It is a cranial bone, okay? And it's separated from the parietal bones via a suture called the lambdoid suture. And this is my favorite suture because lambdoid is just a silly word. I love that word though. So you can see this suture line going through and separating the parietals from the occipital. Okay. Now the other thing that we have labeled here are sutural bones. And so these are bones that a person may have them, may not have them, may have a lot of them, may not have a lot of them. It varies between individuals of how many suture bones they have, but these are bones that just kind of form in between the sutures. We don't really give them names. I don't really have you identify them at all, other than, they can be there. Okay. So now we can go on to the lateral view. And so we're getting more of a view from of different cranial bones and really just getting a better view of some of these facial bones, really exposing more of these bone markings. So again, we need to know all of the bones and we need to know these bone markings. I will talk about their specific function only if I say, hey, you need to know this, do you need to know it. All right. Now, some of these terms that are crossed out, you absolutely do not need to know, like lacrimal fossa or articular tubercle, temporal squama, right? You do not need to know those. Okay. Mastoid portion, not really going to be testing you on that. Down here, the external occipital protuberance, as well as the external condyles. Excuse me, that was my phone, so sorry. These two terms that are crossed out, you do need to identify them, but not from this view. So I cross them out. All right. So we're only focusing on what's not crossed out. So let's view. Here it is unlabeled, so you can maybe test yourself at a later time. But let's go through it. So first off, we have the mandibular fossa. Can we remember what a mandibular fossa is? I'm sorry, not the mandibular fossa, but can we remember what a fossa actually is? A fossa is one of those bone markings, which is a shallow depression where a bone can articulate, right? Bone can connect. So the mandibular fossa is of the temporal bone in purple. Okay, so this is a new bone that we're able to really get a clear view of, the temporal bone. We were able to see it from the anterior portion, but now we're really seeing it in its entirety. So the mandibular fossa is of the temporal bone, and it's where obviously the mandible can articulate, and we'll talk about that more. Now, we do have another suture, the last suture to go over. This is the suture that separates the temporal bone and the parietal bone. So there are two of these sutures because we have two temporal bones on either side of the skull on the lateral sides. So this is the squamous suture separating the parietal bone in pink from the temporal bone in purple. We can also see the coronal bone, suture here separating the frontal and the parietals, and we can see clearly the lambdoid suture separating the occipital, that inferior and posterior bone of the skull, from the parietals. Okay, so still referring to the temporal bone, we have the zygomatic process of the temporal bone. All right, now on the zygomatic bone, which if we remember is our cheekbone, zygomatic bone, we have the temporal process of the zygomatic bone. So we have a zygomatic process of the temporal, and we have a temporal process of the zygomatic. Together, these form the zygomatic arch. So in lab, if you get to hold a skull model, you can actually wrap your finger around the zygomatic arch. This is kind of sitting further away from the skull, right? So the zygomatic arch, whether you're looking at the zygomatic process or the temporal process, this is a muscle attachment point for muscles of mastication. So again, muscles of chewing. And you could see how close that is to the mandible. And so it is going to kind of have that, and the maxilla, of course. So it has muscles for mastication, chewing. Over on the temporal bone, we do have an opening called a meatus. Sometimes this is called a canal, but it is a meatus. Okay, this is the external auditory meatus. Sometimes it's even called external acoustic meatus. Both are fine. This is essentially your ear canal. Okay, this is if you clean your ears with Q-tips or something, which you shouldn't, but if you did, you would be sticking your Q-tip through bone essentially, and the actual bone marking is external auditory meatus. So the function of it is actually to direct sound waves. Yeah, you should know that. this is your ear canal. So this is what's directing sound waves into the internal portion of your skull and to your brain. Okay. Then you have the mastoid process, which is posterior and inferior from the external auditory meatus. So you can actually feel this one. So if we find our ears, right, find our ears, put our fingers in our ear canals, right, plug your ears with your hands first, or with your fingers for a second, and then quickly take them out so that you can actually still hear me, right? Move posteriorly behind the ear, and you should be able to feel kind of this portion hanging down, and you can kind of wrap your finger around this mastoid process. Okay, so the mastoid process is an attachment point for various neck muscles. So you will see that term come up again once we introduce the muscles. Directly below or inferior from the external auditory meatus is this like dagger-like portion called the styloid process. So the styloid process right here is of the temporal bone. And it is kind of it's like at an angle towards the anterior, right? But it is inferior of the external auditory meatus. So you'll be able to kind of identify that on a model in lab if needed. This is an attachment point for tongue and neck muscles. Now we can come down onto the mandible. So again, the mandible is the only movable bone on the skull, and we have the mandibular ramus. So the ramus is essentially this portion of bone that connects the body to these upper projections. Okay. It also is an attachment point, but it does help form this really important joint, which we do need to know this. Okay. The temporomandibular joint, TMJ for short. Okay, the ramus helps form that joint. Now we do have the mandibular angle, which is really just the angle of your jaw, and you can feel this yourself if you feel around on the sides of your jaw, like go to your chin and then move your fingers posteriorly. You will all of a sudden reach kind of this angle and it'll swoop upwards. Okay, that is just kind of like structural support for your face, and it is an articulation point as well. All right, so mandibular condyle is what's trying to be shown here. Mandibular condyle, and we can find our arrow. So here's the ramus, the mandibular ramus, and then we move posterior and superior on the mandible, right? It is the most posterior and superior projection. This is called the mandibular condyle. And this mandibular condyle is going to articulate directly into the mandibular fossa of the temporal bone. So this articulation, this connection, creates as well the temporal mandibular joint, the TMJ. Okay, so this is how we're able to have this movable bone here in the skull. Because if we remember a condyle, we could identify this projection as a condyle because it is a protuberance, it is rounded at the top, it's smooth, so that it is going to fit perfectly into that shallow depression that is a fossa. Then we have the mandibular notch. Okay, so anytime we see the word notch, we're looking for a U shape, and that's exactly what we have, a little U shape here. And then moving anteriorly, the other side of that U is the coronoid process. So the coronoid process is really important for muscle attachment. There's a muscle that goes over the temporal bone called the temporalis, and it's going to connect right onto the coronoid process. But if you're having trouble keeping these terms of the mandible in line, just remember your notch, okay? The mandibular notch means a U, right? So that notch is going to be right here. X marks the spot. Posteriorly, you have a nice condyle, and that's going to be your mandibular condyle. Anteriorly, you have more of kind of a jagged point, kind of. It is rounded, but it's not as much of a protuberance. It's actually flat. If you get to hold it, it is flatter, and it comes down, and then you could draw it out. And okay, this is where your teeth would be. I'm obviously an artist. This is great. Yeah. And then you're on the other side of your mandibular condyle. If we were to follow that down, there's the ramus, and then you have an angle. Wow, that's a beautiful mandible right there. So I think always starting with the notch and then moving anteriorly or moving posteriorly first. This again, the coronoid process is flat, where the mandibular condyle is more of a projection, more of like it's a bony projection coming out, whereas this is just kind of a flat. Okay, so like the mandibular condyle kind of like extends laterally, and it's just kind of large, and it could like put a good grip on it, whereas this is just flat, be really, really skinny. Oh my gosh, okay. Da-da-da. Cool. Okay, and then lastly, we do have the body of the mandible, which again, we do have those mental foramen on either side of the body. They're just not labeled here because we saw them better from the anterior view, but we could still recognize it here, as well as the alveolar processes where the teeth go into the actual bones here. Alveolar process of the mandible and alveolar process of the maxilla or maxillary bone. But again, the body of the mandible is really just a structural support of the face.